to functional therapy in our movement library. What we'd like to share with you is a traction exercise that you can easily do at home, and it's so essential. So often we're sitting. In fact, sitting started in kindergarten. And so what happens when we sit, we have gravity acting on our body, pulling us towards the center of the earth, and then its opposing friend called reaction force. So what happens over a period of time of sitting, and time in general, is our body literally collapses. So these mobilizations will help to hydrate not only your spinal discs, but also all the connective tissue in the body. And you'll feel it almost immediately. We recommend doing this quite frequently throughout the day. So what we have here is what we all have at home, and that's a door. Just make sure it's safe so when the door moves, you don't obviously pinch your finger in the door jamb. So the first way to set yourself up on this is simply grab onto the end of a door, but don't use a death grip. The stronger your grip, the more contraction that will take place in your connective tissue. We don't want that. We actually want a traction, not a contraction. Okay? So once you're in this position right here, what you do is you use your pelvis, your hip bones as a driver to drive away from the door. So because you're positioned on the door, and then you use your body as a driver to move away from it, it'll apply a nice tension along the connective tissue. Once you feel that, you then can use your opposite hand. In my case, I'm using my right side to push away even further. The only contraindication to this is if you feel a pinching sensation on the top of the shoulder. You should feel a lot of tension along this lateral connective tissue band. That's normal. We don't want you to feel a pinching here. If that happens, you can change your position, try it again, shake your arm out, and if it happens a second time, this just isn't for you. And there's many other mobilizations that you can do. So once again, once I'm in position, I'm going to use my pelvis to drive away from, my right hand to drive away from, and then I can start to move my body counterclockwise, clockwise. You can change your foot position. Same thing, clockwise, counterclockwise. Move your body around and search the connective tissue. The tissue on the human body is omnidirectional, and that's just a fancy term for multi-directional. So you want to move along all different directions. Now once you have that down and you've searched all these different angulations, what you can do is find that area that you found to be the stickiest. Once you have it, then use your right hand to actually move the door. So nothing's changed with my left side. It's my right side that becomes the therapist for the left part of my body. So as I move that door forward and backwards, it creates an elastic recoiling effect on the left side connective tissue. Once again, I can change my foot position and use that same driver this way. So a door can be used as a great outside assisted device to mobilize that connective tissue and to elongate our body from an environment that tends to collapse us. For specificity on your own body, you can contact Lenny or Brandy, and we'll give you more specifics if you have any troubles at all.